Hello, my name is Julianne Granados. I am one of the owners and founders of Southeastern Communication and Swallowing Specialists and Southeastern Sensory and Motor Specialists. So recently, SCSS has moved out to Charlotte, and we are, building up in this area with hopes to also bring SMSS out here as well. Since moving out here, one of the first patients that we picked up was a candidate for VitalStim. So we have been doing VitalStim therapy with this little one, seeing amazing progress. But with that comes a lot of questions from people. So I decided to do a little video to answer some of the questions that have arose from other providers in the area and our early intervention team. So one of the questions that comes up is, what is VitalStim, right? The first thing. So VitalStim is NMES, which stands for neuromuscular electrical stimulation. It sends electrical stimulation to your muscles to contract them. One of the ways I like to explain this to my parents is, back in the day, that commercial for your ab belt that you could put it on and it would exercise your muscles and you would get abs without even having to work out. Many of us remember that. And that's basically what it was. That was electrodes placed on your abs, providing electrical stimulation to get your muscles to contract and strengthen without you having to actually do anything. And so essentially that's what NMES is. PTs and OTs use it for other limbs, legs, arms that are not strengthening the way they want them to, or getting the results from traditional therapy. We can use this in our dysphagia therapy by placing the electrodes facially or pharyngally. Like I said, it is neuromuscular electrical stimulation. It is FDA approved to use on the larynx, VitalStim specifically. Until recently, VitalStim was the only one out there that was FDA approved to use on the larynx. There are now some others out there, and I believe one of them is like Dynes or something, that therapists are getting training in, and that training has different protocols and things than VitalStim. My training was a weekend-long training. Prior to going to the course, I had to do a review course on swallowing and the function. Is a 40-hour course. And to make sure I was competent in that area. And then we did the training, we practiced placing the electrodes and palpating, and my training was pediatric focused. So a question that I had from a therapist was their training, which was different than mine, taught them not to use VitalStim on, younger kids. My training was by Chow Seminars, and Karen Michelle, who's an SLP out of Chalk, taught the course and was one of the creators of the content. There were two other contributors to the course manual, and she specifically worked in the hospital setting with pediatrics and babies. I have used VitalStim as young as 4 months old. That's not to say that it can't be used for younger than that. It's just that in the setting that I was at before, it was really difficult to get these babies right out of the hospital. We have some issues with the referrals, being sent to doctors and being sent to the CDSA. And, you get to the CDSA and you've got 30 days to contact the family, then 30 days to do assessment. By the time you're getting the babies, they're 4 months old at the earliest. So 4 months is as early as I have done this therapy. But like I said, the presenter, that's what she did. She worked with babies. She worked with babies and other infants and toddlers. Our training taught us to monitor regulation. I'm not going to recommend this therapy for a child who is aversive. I'm not going to recommend this therapy for a child who's not regulated with oral stim and pre-feeding. I want to see that the child can tolerate these things and maintain regulation before I implement this therapy method. And then during, once I place the electrodes, I'm monitoring my child's respiration. I'm monitoring their body language, just as I would with traditional therapy. And if we're having any adverse or negative reactions, then the therapy is discontinued. Surprisingly, that has not been my experience. My experience with VitalStim has been amazing. All of the kids, aside from one that I have done therapy with, have, prior to failed swallow study at some level, whether it was aspirating all consistencies or thin or, back then it was nectar, or, now we're doing different thickening methods. But they were aspirating at some level, and after 1 or 2 rounds of VitalStim, they have taken a swallow study and shown no aspiration on all consistencies. And then our therapy does not include VitalStim after that is working towards full oral feeds. Now, the one patient that did not meet these standards or results, her situation was very different, and she was really, really severe. But the progress that we did see was that this was a baby that wasn't initiating a swallow at all, right? She wasn't managing her secretions. She wasn't doing any of this. And with VitalStim therapy, we got her to initiate swallows and manage her secretions better. So that was the progress that we saw there. The goal wasn't to get her orally feeding. It was to help with better secretion management, because she was trach and a lot of medical complexities. And so that was a success on its own. So let me see what some of the other questions that I have come across. So what does a typical VitalStim plan of treatment look like? So it's a 6 to 8 week treatment. We always do a swallow study or have a recent swallow study prior to. I review the swallow study, find the breakdown in the swallow, and then find the muscles that need to be targeted, whether it's swallow initiation, tongue base elevation and retraction. I'm going to place the electrodes here to get that tongue to elevate and retract to initiate the swallow. Or if it's laryngeal pharyngeal constriction and elevation, there are different types that placements that I can do, whether it's aspiration following the swallow, during the swallow, prior to the swallow. I'm going to assess that. I'm going to review my placements and find the best placement for that patient. So the treatment is 6 to 8 weeks, and I'm looking to do my therapy anywhere from 3 to 5 times a week. Generally, I stay around 3 to 4 times a week, and it's 45 to 60 minutes. When I get to the session, we are placing the electrodes, and then we are beginning our traditional treatment. So we're finding our point of success, and we're working from there, whether it's, we're working on oral motor and function, suck training, or if we're working on trials, passy dips or spoon dips or things like that. During the time I am monitoring the swallow initiation, I'm monitoring for my, pharyngeal sounds, respiration. I'm monitoring all of this. I start the stimulation low, and then if I'm not getting the muscle reaction that I'm wanting to see, then I am, going to work on increasing it and finding that level that's going to be best for the child and best to get the results out that we want to see from the muscles. So what does the E-stim do? It contracts the muscles. So we're building muscle contraction for strength, increased stimulation for muscle reaction, and muscle re-education. The goal is that these muscles are strengthening so they can do the activity, and then the activity thereafter would maintain that strength. So that's just like PTs teaching your kids to walk, right? They initially can't walk, but they build the strength in the muscles, and then the act of walking keeps the muscles strengthening and working for the task that you're wanting them to do. One of my favorite things that the therapist who presented this material, one of my favorite things she said was SLPs are the only field who need proof that if you exercise a muscle, it gets stronger. And that was just like, yeah, you exercise a muscle, it gets stronger. And that is exactly what VitalStim does. It provides that stimulation to contract the muscle, to strengthen it, to re-educate. And so that active, consistent swallowing, so that's what I'm doing throughout the therapy. I'm trying to initiate swallows in any way, whether it's secretions, whether it's trials, whether it's full-on meals. I'm initiating that swallow as much as I can to re-educate, to build those motor pathways, to strengthen, and to get a timely swallow. Let's see, what are some of the other questions? Let's see. So after that first round, we will do a repeat swallow study. Then that swallow study will determine whether we move on to the next round or whether we're done with VitalStim or not. So some of our kids who have been aspirating all consistencies can now tolerate purees or are the only aspirating on thin liquid. So we will continue VitalStim to, further that and get them to where they're tolerating all consistencies. But some after that level are doing well and do not need another round. So we want to see at that next swallow study, has there been improvement? And if there's been improvement, then, are they still aspirating? If so, we'll do another round. I've never had to do more than 2 rounds of VitalStim with a patient. Another question is, what's the family's role? Because, we're all, these are babies and toddlers, so we're in an infant toddler setting in home, working with our early intervention team, which many are working, primarily with coaching. So I will hook up the patient to the VitalStim system, place the electrodes, and then anything that I am asking the families to do at home, whether it be like oral stimulation or pacifier dips or whatever is safe for them to do at home is safe for them to do during VitalStim therapy. I am needed there to monitor swallows, to monitor safely, to monitor the VitalStim. At any point we're doing something that's new that I don't know if, it is safe for the parents to do, then, if we say we're moving from passy dips to now we're, doing consistent syringe drops on the passy, well, then I would then model like I normally would, model and educate. And then once the patient is safe and doing well, and I feel like the parent can do that, then I would then hand the patient over or, have the parent take the reins and then begin to administer under my coaching and teaching. So parents can absolutely take an active role in their patient's therapy with the use of VitalStim. Because even outside of VitalStim, there's going to be therapy that they're going to have to carry over at home, whether it be oral stim, whether it be the passy dips. We're going to find that area of safety where they can, work with their babies at home. Let's see. Okay. So a big question is, how is this put in the IFSP for the patient? Now, back in Fayetteville, they would put it under other services. And then once we were done with VitalStim, back into the IFSP plan, or the IFSP. So out here, now that I'm in Charlotte, it could be a little bit different, whether they want to put it in other services or, include us in the IFSP. It really just depends on how that branch wants to handle this. So, but either way, the VitalStim therapy is, supposedly temporary, that 6 to 8 week period. And, during this time, I'm keeping close contact with doctors and specialists to make sure that everything is going well, and that everyone is on the same page. I think the last thing that I would like to talk about is contraindications. And what is a good candidate for VitalStim? Like, what does somebody look like? So a baby or child who is aspirating, traditional therapy has not worked, and parents have been doing traditional therapy and they're tolerating oral stim and they're not aversive at all. So this would be a patient that is a good candidate for VitalStim. I have worked with babies with heart conditions. I've recently got clearance from a neurologist for a baby with seizure disorders. There's no contraindication for babies with seizure disorders. It's just a precaution, just like anything. So precaution to just keep an eye out for. The neurologist indicated that there should be nothing with the treatment that would affect the baby and activate any seizures. But prior to any special considerations, I'm contacting our primary care. I'm talking to them and saying, this is what the therapy is. This is why I'm recommending it. We want to make sure you're on board. And then any specialists associated, so neurologists, cardiologists, I'm talking with them and saying, this is what it is. Are you on board? This is what I'm recommending. One cardiologist, we did a monitoring session. We did a trial session. There was a monitor hooked up. The cardiologist looked over everything. There were no issues during our trial session, and he gave us the go-ahead to move forward. And that was a baby who had been NPO for over a year, basically taking only up to 10 spoon dips of water a day, and wanted to eat. He wanted to eat so bad, to the fact where parents didn't eat in front of him because he would just cry because he wanted their food. And so he's a cardiac baby. We did the trial session with him, and he did amazing. He did so good. After 2 rounds, he moved forward, moving towards a full oral feed. So I've had such amazing results with this. I love to help my families through this process and work with them and see the amazing results. So hopefully this answered questions, and I would be happy to answer any additional questions about VitalStim that anyone had. When I'm talking with a parent about this, I like to connect them with families who have been through this already. And they can hear it from somebody else, what they thought of the therapy and their experience. So please reach out if you have any additional questions. And I hope this was helpful. And I hope if you have a patient who is aspirating and has not been successful with traditional therapy, or even if you have an infant whose mom wants to breastfeed, or bottle feed, working with infants is an option. And some people aren't sure about that. Like I said, I've worked with a 4-month-old, and we worked on bottles, and then once got a little bit older, then we progressed towards sitting in a chair and doing puree. So working at the breast, working with a bottle is definitely an option for these babies. So hope this was really informative, and thank you so much for watching.